Hi, everybody. Welcome to all. And I am Dr. Raina Chawla. I am faculty of Obs and Gynae at Cerebellum Academy. And we have with us today Dr. Priyanka. And I would first of all like to congratulate Dr. Priyanka. She has scored an excellent rank in this year's NEET PG exam. And it's the rank is of course wonderful, and but what's even better, or what's even more interesting, and which we've seen a lot happening in this year NEET PG, is the jump from last year to this year. There's been a tremendous improvement in her rank. So we'll be discussing this and much more with Dr. Priyanka. So first of all, welcome, Dr. Priyanka, and again, once again, congratulations to you and your family. And
Thank you so
just
much, ma'am.
give us a brief introduction about yourself.
Yeah, I'm Dr. Priyanka Dhanraj from Hyderabad. I did my MBBS from a private medical college, Mahavir Institute of Medical Sciences from Vikarabad in Telangana.
Okay.
That's about
And
it.
which attempt of yours was this? What is your rank right now? Could you just give us a brief about how you performed this year?
Yes, ma'am. Last year, actually, my rank was 50,000, but then I felt that was not my best, and I definitely could give another attempt, the best attempt. So I just prepared. I took a back off when I got my results. I prepared completely myself that I'll give one best attempt. And
Okay.
then I started my journey with this thing to prepare.
Okay. And your current rank is
My current rank is 3,521 from 50,000
okay.
last year.
Okay, so from 50,000 to 3,000 is like a huge improvement. And that's what everybody wants to know, because many people who get ranks in I think above 20,000, 30,000, 40,000, they feel very discouraged. And I'm sure you would have felt the same way. And then you feel whether it's, I mean, it of course, it affects your psyche, and it affects your preparation, and you're always in self-doubt. Can I do this? So what did you do? What did you do to improve, or how did you prepare in this 1 year that you had?
Yes, ma'am. First thing when I got my result, it just shook me. So, but the thing was that I just didn't want to hush into my preparation again and do the mistakes. So first I found out what all the mistakes I have done. I took a time, 1 week, two
Okay.
weeks time for myself. I
Okay.
spoke to all my friends what I should be doing for few months starting, and then later on. It was not like all at once, but then step by step
Hmm.
I kept going. So first few months I have done I made my concept strong. Actually, I was pretty
Okay.
much weak back then. So first I worked on my concepts. With that, I used to do MCQs and also followed BTR. Then I used to annotate. That
Okay.
first phase was only annotating and reading my
Okay.
notes with the concepts and follow doing the MCQs, PYQs mainly.
Okay.
Then I
Okay.
used to do
Okay.
PND one session, and after that, from September, I started preparing with BTR completely, like ma'am.
Okay.
Uh,
Okay.
I used to revise active recall as ma'am told, like twice or thrice I've done active recall.
Hmm.
That would
Hmm.
be one revision, and then I used to again go through my notes. So that would become an addition revision like that. And daily I used to follow like 100 MCQs were sure. I used to do them.
Okay.
Then
Okay.
INICET
That's a
came
very
up.
good number.
Then INICET came up. November INICET was good. So that gave me a push. I got like
Okay.
4,000. So that was gave
Okay.
me a push that I can do great in. So I kept
Yes.
moving
Yes.
like one by one.
Yes.
I gave all my GTs very judiciously. I used to make mainly what I felt is I worked on my mistakes. Whenever I used to do that mistake, what went wrong, why did it go wrong,
Right.
and add on. Like
Okay.
every time it was one step ahead. I used to keep going.
Okay.
I made
Okay.
separate 20th notes copy, and then GT review book I had something differently, and PYQ recall
Hmm.
also actually. But
Okay.
then because
Okay.
whenever I used to give another GT 10 days or 15 days, I used to just go through them. So that made little bit. And giving GTs was like an antivirus running, because sometimes we overread and all. The maximum
Yeah.
mistakes that I made were very silly also sometimes. So that were corrected
Yeah.
there.
And many of us don't realize the silly mistakes ho jate hain, but then you can correct upon them, and you can correct on them upon them by revising and repeatedly doing that question, so you finally eliminate that this thing, the bit of silly mistake which can creep inside. But what is really appreciative, Dr. Priyanka, is how I think everything has been very organized. Just by listening to you, I understand that you've kept your whole preparation. You've been very consistent. I think number one. Number two, you've been very organized, and that's very important. It's not all over the place. You knew what you were supposed to do, and you made a plan right in the beginning, and you followed the BTR, and everything was just all like no. So I'm a very organized person. I every day I wake up, I make a to-do list. I have to do this today. So when you're telling me all this, like I can actually think now, I can actually imagine how you planned your day, and that's very good. And repeated revisions are also very, very important.
Yes, ma'am. I made sure that I made revisions, and I actually, that's what, ma'am. I used to make my list one day prior. Ki what I have to wake up at this time and what I have to do
Yeah.
today. At least a list. This has to be completed. This has to
Right.
be completed. That was definitely to do list was definitely. And then I used to always measure, because Praveen sir used to always say you have to you cannot what do you say, you cannot improve something that you cannot measure. So I used to
Right.
measure the number of
Right.
hours, and daily whatever MCQs I solved, I used to note them down, 50, 60,
Hmm.
70.
Hmm.
Seeing that
Hmm.
number on the wall used to give me a push. Oh, I have to do at least two more correct today, two more correct today. So I used to everything like
So
document.
self motivation is very important. You should not
Actually.
give up. You should not lose hope. You have to tell yourself repeatedly that you can do this. And I think that's what I'm seeing you. You're just so confident. And talking to you, na compare like I speak to a lot of students. I speak to a lot of people preparing from MBBS, and what I see differently in you is that confidence, and that's very important. You have to believe in yourself. And
Yes.
yeah, so self belief, self motivation, consistency, and sticking to or just as you said in the beginning, right at the beginning, you decided you what went wrong the first time and what you're going to do now. And you said concepts are very important. Could you elaborate more on that? Because the paper is moving towards conceptual. We have to accept that. So how do you feel? How did you increase your concepts or improve your concepts?
I feel basically the notes or the earlier last year face-to-face classes notes were very good. I made a very good notes, ma'am. So I used to stick
Okay.
to them first and read the
Okay.
whole of the notes and got the concepts clear, because that is what is important. And then if we solve the MCQ, we will understand
It-
what are they asking
yeah.
and which way are they
Yeah.
asking.
Yeah.
That is we understand. What one difference also I felt is key MCQs also, ma'am, because everybody is doing the theory. Where we lack is
Yeah.
the MCQ skill only. Last year, that was the mistake, I think. And so I worked more on it, because
So
the
how to
question, the way
answer
they
an
are asked,
MCQ? Yeah.
so the way they are asked, and the what they're asking, we should be knowing. If we don't understand it, then we'll just randomly, if we see one option,
True.
our mind will say that only. We don't know if
True.
it is right or
True.
not. So
True.
reading all the
True.
four options, ruling out why this and why not
Yes.
that. The two,
Yes. That's very
I was stuck.
important.
Once I was
That's how
stuck
it is.
between
So when I as
two
an examiner
options.
if I am to make a MCQ, I will give two options which are very similar, because I want to test the students' conceptual knowledge, whether they know what to exactly look for. So that's where this becomes important. Two answers would always be similar. That's important to understand how to do the MCQ. So that's also a very important point which you have covered. Acha, one more thing I want to ask you is, when the exam was postponed, how did it affect you mentally, or what did you do, or what did you take it use it at your advantage, or were you in shock for a few days?
I think, I mean, this June, after seeing my rank, must have been an advantage only. But then Jan, when it was postponed, I was very much shattered. I cried a lot that day. But then
Oh,
I
okay.
took a break also off. I mean, I couldn't gather. So 20 days to वैसे ही गए थे. So then again, I started back in Feb. But I was very serious, because I was like कि this time जो भी अभी तक preparation किया गया है, it will
Hmm.
come spill
Hmm.
completely. If that happens once, it is very difficult to get back. So I pushed myself maybe 2 hours or 3 hours, or even very little amount. Also, I made sure that I'm only with the books. I did not take any break or something, because you
Okay.
get diverted before and after all that. So I didn't want it to also, because I just didn't want it to get diverted. I was off completely social media and everything also.
Right.
And then
Right.
when it happened in June, it became like ki, okay, the it has become so uncertain. It pretty much
Yes.
didn't affect me. I was very angry, but then it is a
It
helpless
didn't
situation.
affect you.
Nobody can do
That's good.
anything.
That's good. You can't change what is not in your control. So
Exactly.
just go
Then,
with the
yeah,
flow. everybody is going through the same thing. You
Yes,
should be
ma'am.
able to adjust yourself to difficult circumstances. It's already you're going through so much of difficult situation, but then that's how doctors have it, I think, in India. And that comes to my next question. What do you want to take? Which department? I mean, what subject do you want to pick up?
I actually like OBGY, ma'am. But
Okay.
I am
I'm very happy to hear that.
थोड़ा सा dicey between two
Okay.
completely different branches though, derma and
Okay.
OBGY. I've always liked
Okay.
OBGY, but I don't know, because of my rank, maybe I get
Yeah.
derma, I'm thinking derma, or I don't know. I'm very much
I think if you
confused.
get
I've been,
both at your rank easily, you can get both. Yeah, but they're completely separate. Like OBG is
uh,
yeah
hectic and peaceful,
very
so
very busy, and Derma is not busy at all. So they are, but both are good fields. I mean, so I think I wish you all the very best. And it was really nice talking to you. And if you want to ask me or the team anything, you're most welcome.
I think
Or if you want to say something for any specific faculty, I'm sure the
oh,
PTR
I
helped
would
you.
love
So you
to.
are
Yes.
please, so whatever you want to say.
Yeah. Firstly, Zainab, ma'am, thank you so much. All the efforts, hard work. I used to feel that pain what ma'am has taken for all of us, because it's not easy having a toddler at home and everything. She has been an inspiration. I would personally thank you also to ma'am from my side.
Your message
And
work awesome, ma'am.
Zainab ma'am, and then Praveen sir, Apur sir, and Ravi sir. Whenever I used to feel depressed or something, I used to watch their videos. They were so motivating. One single line also used to push me so much. And one thing which Apur sir used to tell, I wrote it down also, कि तेरी किस्मत दा
Okay.
लिखा तेरे दिल कहीं खो नहीं सकता, तू श्रम करा चल बंदे, जे उस
Good.
दी महर होवे तो तेन वो भी मिल जाए जो तेरा हो नहीं सकता. I used to love that,
Yeah.
and that
So
kept
that's
me
in my
going forward.
OPD also those lines are there.
Yes,
So yeah.
ma'am. And then Ravi sir, very realistic approach. Like
Yes.
he used to show
Yes.
the mirror exactly, and very
Hmm. Hmm.
practicality. That also
Hmm.
kept
Hmm.
me going. And
Hmm.
Vivek sir and Garg sir, Govind Rai sir, ma'am. Pharmacology was very easy. I mean, I made all the flow charts. I could revise only it in 3 hours. So I'm very, and Vivek sir also PSM made it very simpler. All this faculty, I'm so thankful to all of them, ma'am.
I'm so glad we were there to help you along your journey. And if you take OBG, then we will help you further. At least I will be able to help you further
Definitely. I'll
along
let you
your
know.
journey. So, all the very best, Dr. Priyanka. It was a pleasure talking to you.
Thank you so much, ma'am. Same from my side, ma'am. Thank you for having
Thank
me on
you. Okay,
Cerebellum.
bye. Good night. Bye.
Bye, ma'am.